In this video, I'm going to discuss about the supporting mechanism of foot and foot arches. In erect position, the heel, lateral margin, ball of the foot and pads of the distal phalanges touching the ground. Ball of the foot is the part underneath the metatarsal heads. When we look at the medial margin arches between the heel and the big toe, forming an obvious medial longitudinal arch, but it contrasts with the lateral margin which is in contact with the ground. Why do we need foot arches? Foot is not a rigid structure but rather a flexible structure able to deform when it contacts the ground. This flexibility is very much helpful to absorb much of the shock which is generated from impacting with the ground. If feet were more rigid structure, with each impact of the ground, it would generate extremely larger forces of short duration. These are shocks that would be propagated through the skeletal system. There are 3 foot arches we can learn in upcoming slides. Now the longitudinal and transverse arches facilitate weight bearing and also distribute body weight over the foot. And these 2 arches act as shock absorbers and also they provide resilience to the foot, allow foot to adapt to the changes of the surface contour. Due to all of the above reasons, only a smaller force for a longer duration is transmitted into the skeletal system. What happens in standing position is due to the body weight, the arches sink and individual bones lock together and then the ligaments linking them are in maximum tension and then the foot become as an immobile pedestal. But when it starts to walk, body weight releases from arches and this unlocks and foot again become a mobile lever system. So we'll learn the foot arches in depth. We have 3 foot arches. One is medial longitudinal arch in the medial aspect and the lateral longitudinal arch in the lateral aspect and the transverse arch located at the bases of the metatarsal bones. First we'll discuss about the medial longitudinal arch. The bones contribute to form this medial longitudinal arch are calcaneus most posteriorly and then the talus, then navicular and 3 cuneiform bones, medial, intermediate and lateral and then the medial 3 metatarsal bones. So those are the bones contribute to formation of the medial longitudinal arch. But among these bones, there are specific bones which contribute and act as pillar of the medial arch. So these bones are very crucial. Posteriorly, the calcaneal tuberosity act as a pillar and anteriorly heads of medial 3 metatarsal bones. Lateral longitudinal arch formed by the calcaneus, cuboid and lateral 2 metatarsal bones. This arch extends from heel to the head of the metatarsal bone and you can see when you compare with the medial longitudinal arch, the lateral longitudinal arch is much flatter than the medial longitudinal arch. Then the transverse arch, actually it's not a complete arch, it's a half arch and being completed by the transverse arch of the other foot. This is formed by the bases of the 5 metatarsal bones and the adjacent cuboid and cuneiforms. When we talk about the factors contribute to maintain the integrity of foot arches, among them there are bones, ligaments, muscles and tendons. But their relative importance is different among these 3 arches. For the medial longitudinal arch, bony factors do not play a significant role, but ligaments play an important role. And among them, the most important ligament is the plantar aponeurosis. It stretches like a bowstring between the supporting pillar, and when the big toe extension, it draws the pillar together and increase the height of the arch. Now, when this plantar aponeurosis shortens during big toe extension, what happens is it shortens the distance between the heel and metatarsals, and this causes elevate and shifting the arches for push-off during activities like walking. Then the next ligament is important is the spring ligament or the plantar calcaneonavicular ligament. This is also a key static stabilizer of the medial arch, and this also supports the head of talus. You can see this is the spring ligament. It nicely supports the head of talus. Then another most important tendon is the flexor hallucis longus tendon for the medial longitudinal arch. This is the flexor hallucis longus tendon. You can see it is a crucial to maintain the arch and the most important muscular support. Now this tendon is assisted by the second and third tendons of the flexor digitorum longus. These tendons also receive a slip from the tendon of of flexor hallucis longus. These tendons act as bowstrings along the medial arch from the sustentaculum tali to the medial 3 digits and draw the pillars of the arch towards each other. During activities like propulsion and standing, body weight throw greater strain on arch, and this strain is taken up specifically by the contraction of the flexor hallucis longus muscle and the tension of the flexor hallucis longus tendon. Then the short muscles in the first layer of the sole, abductor hallucis, and medial half of the flexor digitorum brevis also contribute to maintain the medial longitudinal arch. Tendons of tibialis anterior and peroneus longus also important. These two inserts into the same bone and exert opposite effect on the medial arch. Peroneus longus lower the arch and the tibialis anterior lift the arch. And then the tibialis posterior tendon also provide a dynamic support to the arch. To the lateral longitudinal arch, bony factors not a crucial factor and bones do not contribute to the stability, but ligaments play an important part. To this, the lateral part of the plantar aponeurosis and long and short plantar ligaments contributes more, and they act as bowstring beneath the arch. And to the lateral longitudinal arch, the most important single factor is the peroneus longus tendon, and also the fourth and fifth tendons of the flexor digitorum longus also contributes. This is assisted by the quadratus plantae or the flexor accessoris muscle, and again the lateral half of the flexor digitorum brevis and abductor digiti minimi also contributes. These are the muscles of the first layer of the sole. To the transverse arch, bony factors play a mixed role, and the most important factor is the tendon of peroneus longus. So far we discussed about the stability of the foot and the foot arches and what are the contributory factors to formation of the foot arches and their stability as well. And then we'll go through one clinical scenario related to these foot arches. This is the pes planus or the flat feet. Now the soles appear to be flat is normal up to the age of 3 years. This is due to the thick subcutaneous fat pad in the sole. But when the child is grow, the fat is lost and the normal medial longitudinal arch become visible. Flat feet can either be flexible or rigid. Flexible is lacking the arch when weight bearing, but normal arch appear when there is non-weight bearing position. The rigid flat feet is whether it is weight bearing or not, the arch is flattened. Now the flexible flat feet is due to loose or degenerated intrinsic ligaments contribute to the medial arch. This cause inadequate passive arch support. This is usually common in childhood and this condition resolve with age as the ligament growth. But rigid flat feet is usually due to bone deformity such as fusion of adjacent tarsal bones, and acquired flat feet or fallen arches common in elderly. This is due to dysfunction of the tibialis posterior, could be due to a trauma, degeneration or denervation. Tibialis posterior tendon acts as a dynamic sling holding up the medial longitudinal arch. When there is a dysfunction of the tibialis posterior, what happens is supportive force on the medial arch is lost and the spring ligament or the plantar calcaneonavicular ligament and plantar fascia alone cannot be hold the arch against the body weight, and spring ligament fails to support the head of the talus. As a result, the head of the talus displaces inferomedially and become prominent, as you can see here, and the medial longitudinal arch become flattened and lateral deviation of the forefoot occur. This is the acquired flat feet or the fallen arches. Thank you. Stay connected with Anatomy Everywhere YouTube channel.